Senator Coates, first of all, let me thank you for your time today and for agreeing to visit with me. I know there's a lot going on in Washington inside the Beltway and that you have a very hectic schedule. First and foremost, let me personally thank you for your many years of service to our great country, both as a veteran in the armed forces and as a strong advocate for minimizing wasteful spending. I appreciate your many years of service and your dedication to keeping our great country as competitive as possible. I'm fully aware that one of the main reasons that you returned to Washington was to see wasteful spending cut through common sense approaches. My name is Eric Southard, and I'm a nurse practitioner working to care for patients in the great state of Indiana. As a family nurse practitioner providing health care services to your constituents, I'm making a presentation to you today to ask you to co-sponsor the Home Health Care Planning Improvement Act of 2013. This is Senate Bill 1332 and its House counterpart, H.R. 2504. Current Medicare policy impedes my own personal ability to provide appropriate care for my patients and your constituents simply because nurse practitioners are currently not authorized to certify a patient's eligibility for Medicare home health services. Even though nurse practitioners provide all aspects of care for these patients and conduct the assessment of the need for home health services themselves, a physician must certify that this assessment has taken place. This burdensome restriction makes it necessary to involve another provider in the assessment process, even despite the fact that they're not involved in the patient's care at all. This results in system-wide inefficiencies with untoward financial and logistical repercussions. Not only is the patient's health being jeopardized by delays in treatment, Medicare incurs additional costs by requiring the involvement of additional providers with reimbursement rates higher than those of nurse practitioners. This new legislation makes an important contribution to the current efforts of Congress to reduce the federal deficit by making Medicare more cost-effective. An independent study found that Medicare could save nearly $310 million over 10 years simply by authorizing NPs to certify the assessments of home health care services that they conduct. I would ask that you please help to remove this redundant requirement by co-sponsoring the Home Health Care Planning Improvement Act of 2013. You know, nurse practitioners have a long history of providing high-quality, cost-effective care to patients of all ages. We're particularly prepared to manage the problems of patients with chronic diseases and the elderly, and should be able to certify our own Medicare patients for home health services. I respectfully request that you strongly consider signing on in support of Senate Bill 1332 and to support other legislative efforts to tear down the walls that prohibit nurse practitioners from practicing up to their full training and potential. Thank you again for your time and your commitment to service. I'd be happy to serve as a resource for you in the future on matters such as healthcare or healthcare specifically related to nurse practitioners and their practice. Thanks again for your time.